Welcome, everybody. I am so honored to have you here with us tonight as we go over fibromyalgia. If you've ever suffered from fibromyalgia, you know how painful it can be, or if you know someone whom has fibromyalgia, you know how painful it can be for them. I put up the fibromyalgia tender points here for a physician to actually say, yes, you do have fibromyalgia. They are going to check. There's 18 points. And on those 18 points, 11 of those 18 points need to be tender. So what that means for a regular lay person is if we are to reach out and just touch the point, for you, it would feel just like a pressure. But for someone with fibromyalgia, let me shut these down for you can see what I'm talking about. For those of you with fibromyalgia, these pain points are going to be very hurtful and they are going to be very painful. And a lot of people do not understand this, which is very sad, especially for those of us who do suffer from fibromyalgia. If you know anything about fibro, it is a disorder that is characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. Researchers themselves believe that fibromyalgia amplifies the painful sensations by affecting the way your brain and spinal cord processes pain and non-pain signals. So what are your neurons saying? What is that frontal cortex saying? What is your skin, your tissue, your muscle, your joints, your visceral organs stating? This pain of fibromyalgia can be so detrimental to those whom do have it. As we know, there are periods of flare-ups, and those are just unbeknownst, and you don't want to get out of bed, you don't want to move, you don't want to do anything. You are in so much pain. It just hurts just to wiggle a finger to move your head. And there are times when symptoms are very minimal, and that is very nice. It is very imprudent for you to learn how to work with your fibromyalgia symptoms, for you rarely do have a flare up. And that's when it's beautiful, is when you can learn all of this to not have these. However, you must know that they will not permanently ever disappear altogether. I used to think mine was completely gone, and then the weather changed and it flared, or stressors happened and it flared. Now, fibromyalgia, as we know, is not a life-threatening disease, even though when we're in the throes of a flare-up, we really wish we were gone because it's that painful. And it doesn't reduce the life expectancy, but when you're in the thick of it, you really wish it would. So the most helpful treatment approach for fibromyalgia is a combination of self-care, physical activity, and cognitive behavioral therapy. And we'll talk a little bit more about that. Medication may also be utilized to turn the pain volume down. in the central nervous system. But that being said, we can also learn different techniques in which to shut that pain down and not have a band-aid put on something and you get a kickback or a malady from the synthesized drug. Pain, there are many syntheses to pain, but if you want something for pain, you can take white willow bark. It is easy on your gut microbiome and it does help with your pain. And what you would do is you would muscle test. Is this appropriate for your body? Yes, I have read about medical medium, and we are going to be talking about that. So the central nervous system, and I will show you a couple techniques of how you want to slow that pain down and to avoid physical activity, but you do need to exercise. So when your body's in a flare, you do not want to work out. I understand that. But we do need to stretch because when your body is in a flare, all of that is inflamed. But if you just lay there and let it be inflamed, it's going to stay inflamed. But if you were to do just a little qigong, just a little stretching, just a little movement, it would allow the counterattack of those to just relax. You can do heat and cold to also help them relax. One of the things that I had a big problem with when I first started 30 some years ago with fibro was the skill to say yes to everybody, even though I felt like crap. I'd say yes anyway. So one thing you need to learn to do is to say no. And remember that you're important and you come first. Another thing with excessively eating sugar. When you have fibromyalgia, you have candida 9 times out of 10, and you will crave sugar. And I mean, you will crave it. And it's a yeast, it's a fungus, so it grows and grows and grows and grows and grows. And the maladies grow and grow and grow with it. And there goes the brain fog, and there goes all other kinds of maladies. So we've got to remove the excessive sugar from your body to starve this out of your body. The next thing with fibromyalgia clients is that they don't get enough sleep. Your circadian rhythm is completely off because your triple warmer is vibrating and not shutting down. Because your body is constantly in pain, you are always in flight, fight, and freeze. So this frontal cortex slips back into this primitive mind and you can't think. Your systems don't function. That is where this, oh my gosh, comes in, where you rub your hands, shake that stell energy off, this one and this one, and you come up here and you just rest and you breathe and you let that energy come back in to that frontal cortex. You need all the blood that you can get. And there's other techniques to help you to get to sleep. We don't need to utilize a bunch of drugs to get us to sleep, but there are things that we can do to get us to sleep. Now, our cognitive mind is so very important. Fibromyalgia, as we ill knew, is characterized by that widespread pain accompanied by depression. And how could you not be depressed? Anxiety, sleep disturbance, and fatigue. Now, the depression, being an EC, BC, belief code practitioner, and all the other modalities, we can come in and we can relieve the depression. We can work on affirmations. We can bring in a positive mindset. We can do emotional freedom techniques. We can utilize the AO scanner. and keep the frequencies going across that subconscious mind that keeps it positive. For anxiety, we can go into the belief code and find out where the root of this anxiety is and remove it completely. And then when you do happen to have anxiety, we've got this between this finger and this finger. We got this web right here. We can put it on our heart and we can tap. And that anxiety goes, and that central nervous system automatically relaxes. That's why it's so important to learn how to run with your energies. The sleep disturbances. Okay, we go through the circadian rhythm. We find out what is causing your sleep disturbance. Then we go through the 5 stages. Then we run through the frequencies of what's keeping that cognitive mind from sleeping. Once we work on this, we teach you new techniques. That's why it's so important to keep your sessions regular with me so we can keep you sleeping and keep everything in alignment. Now, fatigue, as I said, people, and if you have fibro, you know the fatigue just isn't regular fatigue. You are exhausted. You literally cannot move. No matter how much sleep you get, you're even more exhausted when you wake up before you went to sleep. That's where energy V comes in place. That's where vitamin B comes in place. And that's where some certain exercises come in place to help your body fight back. In addition to these cognitive imbalances, remember the forgetfulness is going to be in there. The concentration difficulties are going to be in there, and the mental slowness. That's all part of fibromyalgia. But what if we could turn it backwards? If you could play solitaire, Sudoku, different card games, different games to keep everything firing in your brain, you're not going to lose your cognitive decline as quick, and you will keep your memory back. What if you have play the card game where the cards are over and you work on memorization? There's so many things that we can do to waylay this so we're not in the throes of it, except the problem is when we are in the throes of it and we can't see past those trees because we don't have any help. That's what I'm here for. I am here to help you make a plan and make you soar like an eagle to get you back to where you need to be. Self-care is so vitally important. Stress management. Stress management can be really hard with everything we've got going on around us in the world today, let alone dealing with fibromyalgia. Let's develop you a special plan to avoid and limit your overexertion and emotional stress. Once we identify the triggers and what gets you overexerted, we work on the boundaries and we wire it down to a fine tooth to where this doesn't happen anymore. Sleep hygiene. When I talk to people about sleep hygiene, they look at me like I got 10 eyes going on here. Because fatigue is such a main component of fibromyalgia, getting good quality sleep is essential. And I do mean essential. That's why at 8 o'clock, the lights come down. Get off of your freaking phones. Shut, unplug, get off of this stuff. Come on. Your health is more vitally important than that bloody phone, your iPad, or your computer. At 9 o'clock, melatonin sets in, correct? So at 9:30, I want you doing your sleep techniques, followed by your emotional freedom technique, followed by the hearts that I taught you when we went through the sleep part. exercise regularly. People look at me like, are you serious? I'm in so much freaking pain and you want me to exercise? Darn scootin', I do want you to exercise. I want you to do yoga. If it has to be in the chair and do chair yoga, then do chair yoga. Do yoga, do qigong, do light weights. Get your body moving. If you don't move it, it's just going to be more painful. Believe me, God, I learned it the hard way. And pace yourself. I'm one of these people where I go like gangbusters and then my body goes whoop and I'm done. Can't do that no more, doggone it. I've had my butt handed to me many times. Pace yourself. I will help you to work that up. Maintain a healthy lifestyle. Now, when I talk to people about maintaining a healthy lifestyle, they say, not so much. Yeah, so much. We need to eat appropriately. We don't need to be going out to the fast food stores and getting crap to put in our body. We need to make homemade, real meals to put in our body, period. And I won't say any more about that because I could say a lot. Misconceptions. We know there are many, many misconceptions when it comes to fibromyalgia. I was one of the first 500 people that were diagnosed with this, and people were told that the condition wasn't real. There's nothing wrong with you. You just don't have a very good tolerance for pain. Yeah, worse. Doctors didn't believe it either. And then they started getting on board with it. And it's very hard when they don't believe you for you to get the proper treatment and them not knowing what to do. So they just keep giving you pills. That's how I got to 36 medications and none of them were doing me any good. And they were all fighting together. So it's very vitally important. Now, remember, several rheumatological diseases can mimic fibromyalgia. These are the ones that I got pegged with first before they decided, oh, you have fibro. Oh, we got it all wrong. We've been giving you the wrong medicine. We've been doing this wrong, this wrong, this wrong. So seronegative rheumatoid arthritis, ankylospondylitis, Lyme disease, polymyalgia rheumatoid, lupus. They all have widespread pain along with joint involvement. But you see, they need to go a little deeper because it's just not all off of a blood test. It's not. So we need our doctors to go a little deeper for us. And we need to be talking and telling them, this is what's going on with my body. Don't let them get away with not treating you right. Patients with fibromyalgia, and I do know, commonly feel so misunderstood. We face so many challenges in explaining our conditions to our family and our friends because they point at you and they laugh. Ha ha ha, you don't look sick. There's nothing wrong with you. You're just trying to get attention. If only they knew the pain you are in. The variability in both symptoms and the severity of it can also contribute to the skepticism. But the root cause of fibromyalgia controversy, and it is a big controversy still to this day, is that reasonable people can argue that fibromyalgia is a mind-brain disease more than it's a musculoskeletal disease. In my opinion, it's both because both play a big part in it. Okay. So potential causes. Fibromyalgia has so many causes. It's just the list is humongous. So the first thing, infection, genetics, sleep disorders, stress, family history, abnormal pain messages, trauma, hormone changes, age, chronic illness, weather changes, and depression. When I kept telling my doctors at first, weather changes are causing me to have pain, they said, you don't know what you're talking about. Bull. Because when I get cold, I hurt like nobody's business. And when I get too hot, it makes it hurt that much more. So if any of you are suffering with fibromyalgia and any of this is going on for you, know that you're not alone. That's why it's so important to work with a practitioner to make sure we can stay on top of these. So any abnormal pain messages coming across your neuros, we can stop and reverse and make that pain message be a different message. Isn't that nice to do? Now, genetics and environmental factors. We all know genetics play a major role in almost everything, but there are certain genetic mutations that make you more susceptible to developing fibromyalgia, the infection part of it. And some illnesses appear to trigger or aggravate the fibro. So we would have to go back in through your chromosomes, your DNA, and your genetics to be able to go back through. That's why that AO scanner is so important, to go through your chromosomes and genetics. And we can also go back through miasms and take it from your mother or father's side and see where it ends and what actually got it started, and remove it from here so we can remove it all the way down the field and remove it from past, present, parallel, and all future lives. Because isn't what we're being here for, to teach others, is for others don't have to suffer as we have, to teach them the proper way to deal with things. So environmental triggers, we know that they are getting to be more so, and they are involved, of course, with fibromyalgia into the mechanical and the physical trauma or injury of the psychosocial stressors. And we all know this is a big part. Commonly reported physical traumas, of course, like acute illnesses or physical injuries or surgery or motor vehicle accidents. I've even seen where people that have had mono ended up getting fibromyalgia. So it's all just a little bit different in how everything occurs. We have to remember our belief system also, that inner child. We can go through womb stages. There's just so much that we can do. Now, remember that anyone, because I've been told through the years, not everyone can get fibromyalgia. Yeah, they can. They most certainly can. More women do get it than men, but men do get it, and they get it very painfully so. And it can affect people of any age, and that includes children. But it usually starts in the middle age, between 25 to 40. And the chance of it, you getting it, increases with age. And it occurs in all people, all racial and ethnic backgrounds, because I'm tired of hearing that business too. Diagnoses: chronic, widespread pain. We all know this. We've said this. I've said it 1,000 times, I know. Pain is felt throughout the body. That's the first thing that they're going to look at. Then they're going to look at your fatigue and why you're tired, and if you're having trouble sleeping, and if you need to lay down during the day. Do all of you know what a thyroid push is? Does everybody know what a thyroid push is? Dave, you do? A thyroid push, everybody, instead of laying down and going out, a thyroid push is where you put your feet up above your heart and you do it for 20 minutes and 20 minutes only. And that'll give your thyroid a little push, which gives you a little energy. You can also come into these spots, this kidney 27, tap it and give yourself a little energy. You can also come in here and rub your beautiful ears and give yourself energy. Remember where all those meridians are at. Now, complications. Of course, there's complications with everything we have in life. The pain, the fatigue, the poor sleep quality associated with fibro can interfere with our ability not only to function at home, but to function at work. And that's why it's also important to work with me so we can get you set up so you're not having trouble functioning at home or at work. The frustration of dealing with this is so sometimes misunderstood. The depression and the anxiety, it just makes it that much more. Because even though I worked for a doctor and ran a doctor's office when I first started with fibromyalgia, he was still very confused about how to work with it and how to work with the anxiety everybody felt from having this. So there is a way to deal with this, and I can help you with that. And it's very easy. The treatments, there are so many treatments for fibro, but people don't realize that there's easy treatments. All those, there's really no cure, and that's okay because we can manage our symptoms ourselves. Yay! And it makes us easier to live with when we can manage them themselves than having to be on a bunch of synthetic drugs that just cause other problems. Treatments tend to be a combination of things. So the first thing we do is to make a few lifestyle changes. Not big, we go slow, because if you go big, you're not going to go home, because if you go big, you're going to stop because you don't like the changes. So you go small and you make each one direct, and you do so and you carry it through, starting with your exercise program, and then go to your food, and then those beautiful relaxation techniques, because we do need those beautiful relaxation techniques. So these are just some supplements that you can utilize. I'm not saying utilize them all. No, 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 no. You muscle test. You have your clients muscle test to see what's appropriate for them. So primrose oil helps with pain and inflammation. Garlic capsules inhibit free radical damage in the joints. Kelp is rich source in minerals, and we need that. Geranium is also a powerful antioxidant. Now, enzymes, they break down food. When we are in pain, our body is already fighting with fibromyalgia, and we need to help it any way we can. Protease is a way that we can help our body by breaking down the food. You can also eat papaya if you can have food, if you can have food. If you can have fruit, if you don't have candida that's in stage 1, you can have that 30 minutes before you eat and help it break down your food. The easier it is for your food to break down, your body doesn't have to work as hard, and you metabolize a little bit easier. Vitamin E with selenium for mobilizing the joints. Alfalfa is very nutritious for your body, and we definitely need that. Partiarco is the key. I did not think I was ever going to get mine shut down, and my mentor started me on Partiarco And at first she started me on the tea and it tasted like dirt. And I thought, oh my God, I'm not going to be able to do this. But as soon as I get in a flare, I start taking Partiarco and it shuts it right back down. It works for so many things. And if you want to go deeper on that, we can talk. I like using Nature's Sunshine products. There are many good products out there. Medical Medium. This is what he likes to use for fibromyalgia. Fresh celery juice, 5 mthf, ashwagandha, barley juice, cat's claw, curcumin, and turmeric, licorice root. The only thing I will say about licorice root, if you have a kidney imbalance, you may not use licorice, period. Use ylang-ylang. MSM, remember MSM just doesn't come in a capsule, it also comes in a cream. Vitamin B, A, vitamin D, vitamin C. I'd rather see you use rose hips than just regular vitamin C because I don't want you to have diarrhea. Zinc is also very powerful to use. A couple of the other things I use, if my candida is out there and I can tell as soon as it goes astray, I don't know if you can see this. I found a lot of things and this is the only one that will kill it. And it's Nutritional Frontiers Candida Kill. I use probiotic 11 before I go to bed and sometimes at mealtime. And ooh, almost spilled everything. And this is Partiarco. Now you can take, this also comes in an elixir for kids. You can also take it and put it under your tongue. You can make it into a tea, but as I said, it's like dirt. But if you don't mind dirt, we didn't mind dirt when we were a kid. Another thing we can do, and I don't remember what my next to my slides are, but one of the things I do when my fibro, when those tender points get to be too much, I use bone oil. It's called Evil Bone Water, actually. I spray this on. Don't get it in your face. Don't get it near your face. Don't get it near your eyes. And make sure you wash your hands really, really good because you'll be singing keys you never thought you could. But I put that on first. And then I make this up. This is Copabaya, Rescue, Valor, Ashwagandha, blah, 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 Paradise. Then there's one more, frankincense. And this is my pain oil that I make up for my body and when my fibro is acting up. And Valor is a young living essential oil. And then the antioxidants, this is what I use. I use Thygo. It's really thick. It stays in the refrigerator. But oh boy, I know when I don't use it. Now, I know that I talked to you about magnetic therapy. Let me go make sure I don't have it. Okay, here we go. Manual therapy plays a very vital role in the physical therapy for fibromyalgia. If you're not doing anything at all, you really need to start for you can get your fibromyalgia under control. These hands-on techniques such as massage, but you've got to be very careful in the types of massages that you are going to. If it's a hot stone massage, make sure the stones are not too hot. Make sure they are very gentle. Make sure if you go to a regular massageist that they are careful with your body. I at one time went to a massage and I couldn't move for 3 flippin' days. Literally, by the time we got home, my husband had to carry me up the stairs and lay me gently on the bed. And he had to take 3 days off because I literally could not move. So please be very careful. Myofascial release is also a very good one. Be careful. Joint mobilization is good. Aromatherapy, as we were talking about, is beautiful. Biofeedback works well. Music therapy, where you can just get yourself dancing, turn the music up, feel it, and let yourself be free. Art therapy. You wouldn't believe how beautiful art therapy does for fibromyalgia patients. Just let your imagination go. Bring peace and harmony to yourself. Let's alleviate the pain in your body. Let's improve the circulation and increase your range of motion. Now, I know you've all seen the red light therapy band that I have. If I didn't have those two therapy bands, I don't think my ankles would move very good. And one of the things I utilize are my magnet therapy, south and north, and wherever it is. So say this is where one of my pain spots are. So I would lay this up here like this, and I would tape it down and I would leave it on until the next morning. I wear magnets all the time to bed on my feet because I have neuropathy, and they'll be huge swollen, but by the time I get up the next morning, the pain will be gone, the cramping will be gone, and the inflammation will be gone, and it'll be gone for most of the day. Now, alternative therapy, this is the hot stone massage. Tai Chi is very nice. It's very gentle. Qigong can be very gentle, but it can also make you very exhausted. Go very slow. Chair yoga is very beautiful, and you can overdo on it because you think you're not really doing anything. So make sure you only do 3 reps. Gentle yoga styles. I don't mean going hog wild because you will be sore. So medical societies even strongly recommend for people to have other forms of alternative exercises. Swimming is one of them. Weightlifting is one of them. Hiking is one of them. Walking. And they want you, when I read this on the research paper, I thought, Lord have mercy, I'm never going to make this. They want you doing it an hour, 2 to 3 times a week. And for fibro patients, we can't do that. So what we can do is a couple times in the morning, a couple times in the afternoon, a couple times in the evening. Just get up and move. Okay, that's 10, 20, 30. So see, you can make it an hour just by doing little sets. Don't do it every day. Don't do the same thing every day. Repetition, take it wide, take it far. Allow your body to be the one to tell you. Listen to what your body is saying. You know, we listen to our cars all the time, but we don't listen to our bodies. And evidence of that acupuncture can also help people. Now, I know, do I know that fibromyalgia can be very challenging, and living with it can be just as challenging, but it's just not challenging for you. Remember the other people in the house. So this is how we can get a handle on our pain and our discomfort. But please don't forget everybody in your house. Get a handle on stress with yoga. So when you work with me, we would muscle test which yoga suits you and which ones do not suit you. We would test what time, how much, how long, etc., etc. We would create that frequent exercise regime just for your unique self. Nobody else's is going to look like yours. We would cut the caffeine out because caffeine can make us even more sore. Yes, we will be talking about diet. Schedule time for things that you enjoy, because so many times with fibromyalgia, we don't enjoy much of anything, do we? We're just kind of, ugh, we don't feel good. Communicate with your loved ones. It's so vitally important because your loved ones don't realize what you're going through. They don't have a clue. Pace yourself. It is so important. Take a bath with Epsom salt. But if you're going to take a bath with Epsom salt, you make sure you hydrate.
4.
2 glasses for every bath, okay? And book a massage. Again, we talked about the massage. Sleep. Sleep problems are common, as we said. And it's going to be exasperated by your symptoms and lead you into a very vicious cycle of pain and poor sleep. So practicing sleep hygiene and alleviating your pain. Now, one of the techniques is the one where, of course, you got to rub your hands together, get that energy going, shake the still negative energy off. Put your hand on this side of, well, on both sides of your face, right here is where the nerves come down. So you want to put your hand here, these 3 fingers in the hollow of your throat, and you just breathe, belly breathe, square breathe, not shallow breathe, breathe. Do it on both sides. This will shut the central nervous system down. The more you do it, the more it does it. These fingers, take them right in here. These 3 right here. Again, this is in front of the ear where the messages come down. This is behind the ear where the cranial nerve is, where this bone that comes up in the sleep class, we learned about how precious this bone is for sleep. We can get in there and do that, but we can hold this. And I actually like holding mine together like this because I can feel the energy zip between my ears. And then again, this tapping, you can go up and around your ears and slow down that triple warmer and get yourself sleeping. You can come across here to these oh my gosh points, these main neurovascular points. Come back here to the cerebellum and hold it. 3, come up here to the pineal. 3, the top of the head where the metal element is. 3, here, the temples. 3, the stomach points. 3. These are points to help sleep. Here, bend this finger down there, hold it, warmer. Again, these points across both sides will help you sleep. There's so many things that we can do to help our body sleep. If you're struggling with your sleep, please set your appointment with me and let's get you back to sleeping properly. When you have long-term sleep deprivation, it can negatively impact your immune system. Now, your immune system, you need to be having thriving, and it also can make you susceptible to infections because if your immune system's not thriving, your spleen's not going to be thriving either, and it's not going to be doing all the good work that it needs to happen for those red blood cells. So when you have sleep deprivation, it can lead your body into a low-grade fever, and then God only knows what's going to come up next, right? So your immune deficiency is so vitally important. Your sleep is vital important. Everything is important in the world today, but we're not taking good care of ourselves, in my opinion. So cognitive behavior. I know you hear about cognitive behavior all the time now because of Alzheimer's, dementia, and Parkinson's, but especially with fibro. It is one of the better researched non-drug treatments for this condition. CBT, cognitive behavioral therapy, is a psychological treatment, but it's used to treat an array of non-psychological ailments. And that's where those games and stuff come in. That's where looking at photos, there's so many different types of cognitive behavioral therapy out there. I want you to research them and do the one that is suited for you, because I could sit here and spew them all off at you and it's going to go because it's not one that excites you. So find one that excites you and do it. How does fibro affect you emotionally? Ugh, Lord, we all know what the answer is to that. It is a very high prevalence of emotions and affective disorders, depression, anxiety, borderline personality, obsessive compulsive, PTSD, and comorbidities. There are so many things that can be associated along with fibromyalgia. That's why it's so vitally important to make sure you keep up with your practitioner at least every 2 weeks and make sure you stay aligned. Working on all of these things can make a big difference in your life. Your support system is vital. When I first got this, I didn't have a very big support system and we didn't realize what was all involved. And boy, we surely paid for it. So there is fibromyalgia support groups out there. Like I said, I ran a fibromyalgia support group for 10 years. It was a saver for me. The groups can be fantastic. They are like a big family. And you get your illness validated. People see you, they hear you, they understand, and they know exactly what you're going through and how you're feeling. And it helps your sanity because, Lord, sometimes it feels like you're losing it because nobody wants to hear you. It can affect your mental health because people look at you like, are you for real? You're sick? Get out of here. It's not good. And it's not a good feeling. The depression is very real. So you yourself can play a very important role for the support of your family, for your friends that have fibromyalgia. Be their emotional partner. Help them. Help them to sequester their worries, their concerns. Show them ideas, even though most of the times they probably won't listen. But at least be there to bounce them off. The more supportive that you are, just think of how beautiful you are yourself to be supportive in the first place, to be that soul that can grace somebody else. The better for you and the better for them. If anybody is interested in a support group and literally wants a support group, I will bring up a support group and we can meet weekly, but I don't want to do it on my own. So let's do it together if we want that. Resources. I will try to help you find any resource that you can manage regularly. I am your resource. I want you to stay active and complete. I don't want you to be overdoing. I don't want you to be in flare-ups, even though we do know this happens. Boundaries are so important. Fibro.org, and then there's the National Fibromyalgia and Chronic Pain Sensation. Okay. What is your body saying? Do you ever listen really close to what your body is literally saying? If you're a fibromyalgia patient, Do you feel unwanted? Do you feel knocked down by life's challenges and overstressed? Because it can surely cause fibromyalgia. Are you lacking the strength to get up and keep going every day? That can be a big factor. That can be a belief. You've got too much to do, not enough time to do it, and you don't have the energy to take care of it. Does your life feel like you're constantly fighting? Do you feel stuck? Resistance to growth, to movement, to exploration? Are you overflowing with sadness, regret, guilt, and worry? Are you feeling so depressed, so suppressed, and on guard that you can't see clearly? This is what fibromyalgia feels like. And people struggle to get through it. So metaphysically, there were 10 pages metaphysically of what we would feel like. So, you know how I said when I have done research and most people 6 months to a year prior have a trauma. So metaphysically, feeling like a victim of circumstance, deep anger, rage, resentment towards a person or a situation that caused you to feel controlled, trapped, and abused. You may have made an association that pain gets you the attention you've been lacking your whole life. You've suffered long enough, and now you want the attention to be directed at you, making up for that lack of love and suppressed emotional needs. It's time for you to change how you feel about yourself and how the world looks at you, because you are worthy. You are a priority. You are loved, and you are cared about. If you want to be loved a certain way, if love, according to your specific expectations, is not met, then you feel unloved because your language of love is different than your loved ones. Do you know there's a book on love languages, and we've all got a different love language? And if we don't ever learn the language of love, we're not ever going to learn how to love right. And we're always going to feel like we don't have the love we need. There's so many things we can do to set our mindset straight. And the last thing is to explore womb stages, because you wouldn't believe what comes out of those. So somebody asked me about food, and I thought I had food in here. And apparently I must have missed it. Anyway, food for fibromyalgia sufferers. I want you to follow the Candida worksheet. So that would mean no gluten. I want you eating fresh vegetables, steamed vegetables, lean meat. Yes, I know once in a while you need to have that red meat. I understand that. Okay. But we need to be more careful about how we eat. There's so many toxins in the world today that these toxins are making us sick. And we need to start muscle testing what is for our highest good at all times. So what we would do is we would do the sway test, and we would hold that food right at our sternum. And is this food for my highest good? And you would sway forward for yes, backwards for no. You would want turmeric and curcum because that helps you with inflammation. So we can do many foods, and there's a lot of foods out there, and you can look that up about foods that are good for fibromyalgia, foods that are low in anti-inflammatory. There's so much out there on Google. I couldn't put everything here. So the AO scanner, it is an amazing biofeedback device. Now, this easy scan that I put up here, this scan is unique in the fact that it gives you the lows, and that means what's not functioning properly, and the highs, which means inflammation within the body. It grants you the frequencies of your inner voice. It gives you the supplements you need. It tells you what food sensitivities are going on. It tells you which chakras are misaligned, which meridians are misaligned, which gastrointestinal functions are misaligned. It gives you everything that's here, and we can easily formulate a wellness plan just for you from the AO scanner. And they do have training for it. There's a lot of really beautiful factors that we can do this. Solex LLC is who made this scanner. There's a lot of different scanners out there. Not all of them are the same. Lauren Swenson is the one that made this by Solex. Einstein, Tesla, and Dr. Reif were part of this. Einstein says that frequencies will be the future of medicine, and it will be if this is any lead to what this machine does. So this easy scan I'm offering, just if you put in, hey, I want an easy scan, send me an email and I will give you this easy scan. And that means plus an inner voice for $35. It doesn't sell for $35, period. That's all I'll say. Next, if it'll let me have it. Ah, come on. Okay, emotional freedom technique. I love doing the emotional freedom technique, and I want you to love it too. There are so many people around the world that use this technique, and you can use this technique for simply anything and everything. So if you want to do this with me, please do. You can say it in your mind, you can say it out loud, whatever trips your trigger. So there's a basic sequence you can follow, and it's a setup. So this one is to help us manage our fibromyalgia. So you want to start here on the side of your hand. Let me see what this says. Me, please. I would love, Kim, if you could please send me a note, because I won't have your email or anything from here. If you could send me a note, that would be groovy. And I'll get you a link sent out. Thank you. So on the side of your hand, now your pain from your fibromyalgia can be anywhere in your body. So even though I have this pain in my neck, I deeply and completely accept myself. Now you want to say this 3 times, and I even change it. Even though I have this pain in my neck, I deeply and completely know that I am safe and secure. Even though I have this deep pain in my neck, I know that I'm going to be safe. Then you go up here to the eyebrows. This pain in my neck. And then they'll take you here. This pain in my neck. And then they'll just keep going around this pain in my neck. They'll go around the whole way. Let's see if I get this to go. And they'll go the whole way. This pain in my neck, 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 and this pain in my neck. Okay, then we would come back and we would say, this pain in my neck is decreasing. This pain in my neck is allowing me to take a breath. What if I didn't have this pain in my neck? What if this pain were completely dissipated? It is so wonderful to have this pain gone. It is so nice to be able to turn my neck without pain under your arm. It is a blessing to have alleviated this pain. This is nice to not have this pain. And then you can come back in here and go slower. The release of this pain. To not have this pain anymore. It is delightful to have this pain gone. My body feels ease. Under the mouth, my body feels grace. On the collarbone, my body is at ease. And up here underneath the arm, my body feels relief. And then up on top of the head, this pain in my neck is completely gone. And I am so blessed that through tapping, I can release this pain. And then you just take a deep breath. I always have everybody open your hands, assess your pain, see where it's at.
Where's Bull?
How's everybody doing? Everybody okay? Is everybody okay? Okay. So the next thing, we're almost there. I'm sorry. If I can get this to do this. Oh, I'm glad that was relaxing. Now, I just wanted to reiterate this. Plan and prioritize by breaking down your tasks into smaller and manageable steps and prioritize your activities based on the importance and the energy level you are at currently. Set realistic goals and make sure you check your goals off as you go, because sometimes, we're not real proud. We're getting real critical of ourselves because we don't see ourselves marking off our goals. But if we make smaller goals, we see bigger check marks and we see that we've gone and done what we needed to do. So remember, you need to consider both physical and mental limitations. Avoid pushing beyond your comfort zone. Schedule yourself regular breaks, schedule them right into yourself. Incorporate those lovely rest periods throughout the day. Make sure you're getting protein. Prevent fatigue, make sure you're hydrating, maintaining your energy, listen to your body, pay attention. If you've got some pain, put your hand on it and say, man, okay, there's this pain here. Is there an imbalance here? Remove that imbalance, swish that away, do a figure 8, and let the pain go away. There's no reason on God's green earth we have to sit and live in pain anymore. Manage your stress by engaging in stress reducing activities, and we'll set that up. deep breathing, meditation, gentle yoga. If you need assistive devices, please don't be embarrassed to use them. It makes it easier and less taxing on your body. I had a client the other day who would not use her walker because she was embarrassed for people to see her out in town with her being on a walker. Okay, they know how old you are. They know you just came out of the hospital. They know you're weak. Don't be so critical of yourself. Love yourself like I love you. Okay. Now, there we go. Have you all heard of full court of atonement? I just put this in here because not everybody knows about this. You would just put I and you would place your full name. And this is for fibromyalgia. Place each and every level of my consciousness that is afraid to improve my fibromyalgia into a full court of atonement with the entirety of my family lineage, God and my guides. I ask to analyze my timelines and resolve any and all reasons I resist improving my fibromyalgia at their points of origin. I ask to create openness and willingness to improve my fibromyalgia. I ask for divine intervention to assist me to improve my fibromyalgia in wonderful divine ways. When we put this out into the court of atonement, it allows the universe to take care of it. We can put it out there one time a day and just let the universe take it, because sometimes that's all it needs. Now, how many of you, and I know you've all heard of this, have heard of Ho'oponopono? It is the ancient Hawaiian prayer. And you can say this over and over and over and over again. And it does beautiful, beautiful work. I am sorry. Please forgive me. Thank you. And I love you. How easy is that to say? How easy is that to do? Everybody, yes, Kim, we should be using this daily. How easy is that? Just to rattle that off. You don't even have to memorize anything. It's just right there for you to utilize. Now, another thing that I'm going to offer for fibromyalgia, if you watch this webinar, whether you're watching it now or whether you're watching it on replay, because I know we have a lot of replayers for fibromyalgia, I have a group of 3 sessions that are already discounted at, I can't remember right now. I think at $45, I will knock a $20 bill off of that also. So a 3-pack will be $245 till the end of the month for fibromyalgia webinar, but you have to say that in the chat or you will not receive that. Now, I would like to do for you some Reiki. I think I'm going to be doing this all the time after our sessions because I think we need to relax more. And if anybody has any questions and would like a follow-up, we can do a follow-up next Tuesday to where you ask questions and I answer your questions. But if nobody wants that, that's cool. And if you do want a fibromyalgia workshop or a fibromyalgia group, we're going to have to let me know because I can't read minds. Okay, ready? I want everybody just to take a deep breath, close your eyes. I want you to put your favorite thing behind your closed eyes. Okay. Everybody, please do big belly breaths for me as I'm doing this for you. I'm going to reset all alignments between your spirit and physical self. I am going to reset the communication between your physical and spiritual self. Beautiful. Take a breath. I'm going to reset that magnetic field. I'm going to remove all the inflammation and chronic issues out of that magnetic field, all the fatigue. We're going to put spirit back into the physical back into the spirits. We're going to reset communication between spirits and physical body. And the communication between the heart, the brain, the communication of the left brain. Everybody take a breath. That one's a little bit tougher. Okay, I'm gonna go into the right brain. And what the problem is the corpus callosum does not want to open. Everybody take a deep breath and breathe it out through teeth. There we go. There it's opening. Good, good. Take another breath. Okay. We're going to set all your chakras spinning to the right. Except everybody's chakras are all over the place, so we're going to put them all in a vertical line. Starting with the root, sacral, solar, heart, throat, third eye, crown. We're also going to balance all micro and nanos. I am going to balance first the central meridian, and we are going to zip that up and lock that into the bottom lip. We're going to balance the governing meridian, and we're going to zip that up into the top lip. Put them together. Okay, that magnetic field, we shoved it right out of the way, so we're going to bring it right back in. And then I'm going to fluff up your aura. I'm going to come around your body with hearts. I want you to go down to your feet, take a deep breath. Be thankful for the feet, for the ankles, for the toes, all their hard work. Come up to the legs. How much work they did today. Be thankful and grateful to those knees. Grateful and thankful for the hips and all the movement they did today. Up thankful into the solar and sacral for all the work the stomach and the intestines and the liver and the pancreas and the gallbladder did. Going up into that diaphragm, allowing it to relax. Going up into the lungs. Beautiful. Holding that heart, putting all the pieces back in. Coming up to the neck. We're going to balance that central nerve. And we're going to balance that enteric all the way down to the gut, back up to the brain. And I'm going to hold all of your hormones. Everybody take a deep breath. Please rub your hands together. Shake the energy off. And as I break from you, I want you to put your thumb and forefinger together on your temple and come across the front of your head. I just want you to breathe and sit in that for a couple minutes. Very good. Just allow it to breathe. How we feel. I love building this community. So let us grow together and let the knowledge flow. So set your appointment up today and let's get you to the top of where you should be. So how do you feel? Do you feel okay? Was that a little too much?
It was great, Cynthia.
That
Really
was
good.
good. That felt good. Okay, good, good, good. Okay. Thank you. And I just want to say thank you for joining us tonight. And God bless you each. Thanks.